Hello, I'm Dr. Jake Galbreath, Extension Veterinarian and Livestock Stewardship Specialist here at NDSU, and today I'm going to be talking about health issues in backgrounded calves. So what are we going to cover today? I'll talk about what I call pre-programming calves to set them up to have success on feed, and how this starts long before we actually wean these calves. I'll touch on the physiology of stress in calves. We'll go through some of our main diseases of concern, and then we'll finish up talking about developing preventative health and treatment plans with your veterinarian. So what do I mean when we talk about pre-programming calves for success? So I define this as being the factors that influence calf health that begin before that calf is born, and those stressors that stack up over its entire lifetime. And all of this starts before that calf is even conceived by how we manage the cow and heifer herd. This includes maintaining good baseline health and nutrition so that females can cycle normally. Overconditioning in cows and heifers can result in more difficult births. Appropriate use of vaccinations during pregnancy to develop the antibodies that we want her to pass along to her calf through colostrum. The age of the dam can make a big difference, as cows will typically produce a better quality colostrum than first calf heifers, simply because they've been exposed to more pathogens and have developed more antibodies. And also they're capable of producing larger quantities of colostrum for those calves to take advantage of. At birth, we can help set that calf up for success by having good wet calf protocols, which is anything that we do on the health management side of these calves when they're first born, a wet calf on the ground, a wet calf protocol. So this might include doing like an oral scours vaccine or intranasal vaccines if you've had problems with calf pneumonia, vitamin and mineral supplements, administration of colostrum if they haven't gotten up and nursed already, even in some cases banding calves and administering antibiotics if they're in a really challenging situation. In the case of difficult birthings, calves can get stressed out pretty easily, and this can result in them becoming acidotic. How this could present is calves that don't have very much vigor, they have trouble getting up and nursing quickly enough, and so they don't get that colostrum in that window that they really need it. The figure to the right here shows the typical age in days when we expect to see some of these common health issues in young calves. The figure that I've got posted here just shows the timeline for absorption of antibodies from colostrum compared to the development of that calf's innate immune system. So for the best results, what we want to be able to see is those calves ingesting at least a minimum of 2 quarts of colostrum in that first 4 hours after birth. It used to be we would just talk about getting this done in the first 12 hours, but we found that really in that first 2 to 4 hours is really the pivotal time frame to get good gut absorption of those antibodies from the colostrum. If that calf isn't able to stand up and nurse quickly for whatever reason, we need to intervene on their behalf, whether it's milking out the cow and getting that colostrum into that calf, or using a commercial colostrum supplement or replacer. If that window of time is missed, we still have an option of looking into getting a plasma transfusion, as this is still a way to get those necessary antibodies into the calf's bloodstream. So as that calf gets older, we get to the life stages where we take a more direct role in protecting them from disease. So at branding or at spring pasture turnout, we're typically going to be administering some vaccines, dewormers, maybe doing some fly control, potentially doing some processing, so doing castrations, whether it's by knife cut or banding, dehorning, and then in some cases administering growth promotant implants. When we get into the fall of the year, typically, and we bring those calves back onto the farm, we can do preconditioning. And so preconditioning these calves prior to weaning can help reduce the amount of stress they have to deal with all at once. So if we get their vaccinations accomplished at preconditioning, they're not also going through the stress of being weaned at the same time. If it gets vaccinated, dewormed, maybe castrated or dehorned, but can then go back to mom right away, that calf is going to recover from that stress much more quickly and allow those vaccines and those treatments to do their job more effectively. If we do these all at the same time as weaning, not only can it be harder on those calves, causing reduced gains, performance issues, but it can also reduce the effectiveness of the vaccines that we're trying to give them to help prevent those illnesses in the future. Next, we'll go into a little bit of physiology of stress here. So one of the main drivers of the physiology of stress is cortisol, which is also commonly called stress hormone. And this is derived by the HPA axis, the hypothalamic pituitary adrenal axis. So short-term stresses can actually be beneficial, as short-term cortisol can cause an increase in heart rate and energy mobilization. It stimulates the release of inflammatory cytokines, which can increase blood flow to the sites of damage or sites of infection, and actually increases temperature in those locations that can help drive immune-mediated enzyme responses. And so in some cases, fever can be beneficial to enhancing our immune system, but we don't want them to get super high fevers. It's going to be detrimental to their overall health. Cortisol also enhances the activity of natural killer cells and neutrophils. Both of these are what we call innate immune cells. They're kind of the general infantry of the immune system, the cells that respond to generalized trauma and inflammation. Chronic stress, on the other hand, can have some pretty serious negative impacts on immune function. This can lead to reduced T cell activity. So T cells, they're more like the Navy SEALs of the immune system, and are very important for the memory response in the immune system, learning to recognize pathogens more quickly. This can result in a reduced response to vaccination and potentially put them into an inappropriate inflammatory reaction. Stress response can also be driven by catecholamines with adrenaline and noradrenaline. In the short term, again, these can have beneficial effects, again, enhancing those NK cells as well as macrophages, which are another generalized immune cell. They can also stimulate the immune cell release from the bone marrow in order to mobilize more of these white blood cells to where we need them to act. But again, chronic stress levels with these compounds can be detrimental to their health. We can see alterations in the function of T cells as well as B cells. B cells, which are another memory cell of the immune system, which are important for antibody production. These changes can result in a weakened adaptive immune response and increased inflammation, which can hurt overall performance. So the big takeaway here is that we want to use the short-term stress from vaccination to stimulate a beneficial response by the immune system, but if we're allowing too much stress to occur at the same time, we're really shooting ourselves in the foot by reducing the effectiveness of the immune system to respond to those vaccines, so we're not getting as much bang for our buck in those situations. Next, I'm going to talk about some of the main diseases of concern that we deal with when we're in a backgrounding setting, and we're going to start off with the viral respiratory pathogens. So infectious bovine rhinotracheitis, or IBR, also sometimes called red nose, is a highly contagious virus that affects the upper airways in cattle. This can cause inflammation, high fevers, coughing, and drainage from the eyes and nose. In a confinement setting, IBR can spread through a population very quickly, causing high rates of sickness or morbidity. Luckily, IBR does not typically cause death in and of itself. However, it does impair the normal defense systems of the upper respiratory tract to make them more susceptible to a secondary bacterial pneumonia. So in the picture here at the top, you can see the inflammation within the trachea in this top picture, and that interferes with the normal mucus production that traps bacteria before it can reach the lungs and then is expectorated out through phlegm, through coughing, or swallowed down into the digestive system. BRSV, or bovine respiratory syncytial virus, can be either a primary or a secondary pathogen, can present with similar outward symptoms as IBR, but as opposed to IBR, which affects the upper airways, BRSV affects the lower airways. So you might see animals that are breathing heavily, but with IBR, if you put a stethoscope on them, their lungs will sound nice and clear, whereas with BRSV, you're going to hear those crackles and wheezes going on. So both diseases will cause fever, drainage, increased respiratory rates, but BRSV is causing more damage to the lung tissue itself. Calves that survive these infections can develop scar tissue in their lungs, which could potentially affect their performance down the road. Parainfluenza type virus type 3, or PI3, typically causes a more mild infection with signs that may or may not be noticeable, but still similar to the other respiratory viral infections. However, again, these can potentially lead to a secondary pneumonia. Luckily, on its own, PI3 is rarely fatal. Bovine viral diarrhea virus, on the other hand, can be a challenge because these infections can range from being subclinical, where you don't see any signs, to severe GI disease. A major source of BVD in herds comes from persistently infected calves, also called PI calves. These are calves that get exposed to the virus in utero during the first 4 months of gestation. They'll become infected and shed the virus for their entire lives, but won't show symptoms. And so they'll be shedding this in the environment for other calves to become infected. Luckily, there is testing available for PI calves, typically either using blood samples or ear notches. The severity of BVD depends on the viral genotype or subtypes. In some cases, it can potentially cause mucosal disease, mucosal lesions. And so in cases where you see these mucosal lesions, these need to be investigated to rule out foreign animal diseases like foot and mouth. Moving into the bacterial respiratory pathogens, the first one we're going to talk about is Mannheimia hemolytica. This is a bacteria that causes extensive hemorrhage, tissue death, and fibrin within the lungs. This disease process typically moves quite rapidly, sometimes resulting in sudden death without ever actually seeing those animals being sick. You can see the extent of the fibrin deposition in this in the picture on the left. Pasteurella maltosida, on the other hand, is a more chronic smoldering infection. Doesn't cause nearly the degree of fibrin development and tissue necrosis, but still causes damage in the lower airways, can cause that suppurative bronchitis, and can potentially affect their performance down the road. Histophilus somni, previously called Haemophilus somnus, so sometimes you'll hear that be used interchangeably, but this is a bacteria that we usually see affecting calves after they've been on feed for a few weeks, and typically in the fall months, usually October through January. And this bacteria can present in different ways. It can affect the heart muscle, resulting in poor performance or even sudden death. It can present as more of a respiratory pathogen, causing pneumonia, fibrin deposition over the lungs, but it also can present as a neurologic disease if it's affecting the brain. This can present with stumbling, incoordination, potentially seizures, and once you start to see clinical symptoms of this, treatment is rarely going to be successful. As with any case of neurologic calves, it's important to rule out other potential causes in a feed yard setting, such as polio from having high sulfur content in feed or water, lead toxicity from batteries that might be along a electric fence line, and with any neurologic disease, rabies does need to be on our list of possible causes. So producers really need to be in contact with their veterinarian in these situations in order to be able to examine those affected animals and submit the appropriate grain samples if necessary. Also, we don't want to have producers exposed to rabies virus. The last bacterial pathogen that I'm going to talk about here, the last bacterial pneumonia pathogen I'm going to talk about is Mycoplasma bovis. This is a respiratory disease that can cause these cheesy abscesses within lung tissue. That's what caseous means. It's like cottage cheese nodules within the lungs. Calves will sometimes develop an inner ear infection, causing a characteristic head tilt. And then it can also set up shop in the joints, causing some pretty severe arthritis, which can result in joint swelling as well as severe lameness. Mycoplasma tends to progress more slowly, and so early treatment is important. It's important to catch these cases very early in order to have success, because even if you get the pathogen treated, the damage that can sometimes be inflicted, if it's inflicted too late, can cause serious performance issues, such as if there's a lot of joint damage that can result in chronic lameness in an animal, potentially could result in the need for early culling. Next, I'm going to talk about clostridial bacteria. Clostridia in general are an anaerobic bacteria, typically found in the soil and GI tract, and it is a normal bacteria of the gut. These are bacteria that can form spores that can be very resistant to destruction. And again, they're all anaerobic, and so they need a low or no oxygen environment in order to thrive. So different species of Clostridia can cause different mechanisms of disease, but they are all characterized by their production of toxins, and they all have a potential for causing very rapid death. Clostridial infections will establish themselves in low oxygen environments, which are prevalent in wounds, bruised muscle, or dead tissue, such as at banding. Vaccination is typically very effective at preventing these diseases, and luckily there are a number of options for commercially available clostridial vaccines. Tetanus is, I'm just going to highlight a couple of the more common ones that we see. So tetanus is the one that we probably think about the most in terms of seeing it the most, and the one that we see most threat of with our normal processing. So typically we will see tetanus onset after castration, typically with banding. And that's because of the necrotic tissue that's causing. The tetanus toxin causes severe muscle spasms and contractions. Luckily, we do have a lot of options for tetanus vaccine. To have the best preventative results, you want to give that vaccine 3 weeks prior to castration. That way we can get the maximum antibody response from the vaccine. Clostridial perfringens is another bacteria that is found in the GI tract, but it can take advantage of the wrong conditions in order to cause disease. You might see on a vaccine label that, like your typical 7 or 8 way, will say Clostridium perfringens type C and D. So the different types of perfringens are A, B, C, D, and E, and these are based on the types of toxins that they produce. But typically all of them will cause GI hemorrhage, bloody diarrhea, bloat, and shock. Clostridium perfringens needs the right circumstances to cause disease, such as when cattle are stressed and immune function is impaired. It's also often associated with high-performing calves on feed, as the Clostridium bacteria, it replicates very well in a high-starch environment. So when you have these high-growth, fast-growing animals, they're eating a lot of feed, that can actually put them more at risk because it makes a perfect environment for Clostridium perfringens to proliferate. Most of your commercial vaccines are going to have protection, most of your commercial clostridial vaccines, that is, are going to have protection for type C and D, and those also have cross protection for the type B clostridial perfringens. If you have a herd that has a history of type A infections in the past, there are commercial and autogenous availables that are available as well. We don't usually see much for type E vaccines because type E can be much more difficult to get a vaccine for because there can be so much variation in the type and number of toxins that bacteria actually produces. Other disease concerns that we have include salmonella, which can present in both a respiratory form as well as causing GI disease. Coronavirus, we usually think about that as a potential cause for calf scours early on in life, but this can also cause respiratory infections in cattle on feed, especially in confinement situations. Pink eye can be caused by viral and bacterial pathogens. A lot of this is going to be a management concern, so having adequate mineral and fly control is really important for helping to prevent pink eye. Also managing your yards to cut down on dust and irritation. Any case of bloody loose stools in calves on feed should be checked for coccidiosis. Most of your rations, probably going to have a coccidiostat in there, but you want to check those out, especially if you see bloody mucousy stools. Acidosis can flare up due to nutrition changes. Acidosis, if it's subclinical, can impair immune function, leading to increased rates of pneumonia. You can also see with more acute acidosis potential for bloat and even lameness. Water belly, that occurs when bladder stones lodge in the urethra and prevent normal urination. In these cases, it's important to recognize these very, very quickly so that you can have a veterinarian intercede on their behalf, typically a surgical salvage procedure to allow them to continue to urinate. If that bladder ruptures, the outcomes generally get to be much more poor. So to prevent disease, you really should be hopefully developing a herd health plan with your veterinarian. And this is to address issues that are specific to your operation. And so this involves maintaining a valid veterinary client-patient relationship, or VCPR, and that does require that the veterinarian be physically present on the farm at least once per year. So when I would be setting up these relationships with the producers, I would often ask them to fill out a form with details about their operation, how many cows, how many calves, what are they doing as far as backgrounding, but also I want to know about any kind of health problems that they've been having, so that when I'm on the farm, we can talk about those more in detail and try to come up with plans to address those. During the visit, your veterinarian can evaluate your handling facilities, see if there's any gaps there that might be causing injury to animals or impeding flow. You can also discuss how to properly implement a VFD, a veterinary feed directive. So if there would be a situation where we would want to put antibiotics in through the feed, we need to make sure that we have the feeding facilities necessary to make that actually happen. So with VFDs, you need to have enough bunk space for all of those calves to be able to eat at the same time. Otherwise, you might have some animals that are eating way more of the antibiotic, and you might have some that don't get any at all. Your veterinarian can also help you to develop treatment protocols to help you know what to do when a situation pops up. You should have that discussion so you know what's an emergency, what's an urgent problem, and what is potentially just a routine problem. Emergencies, those are things obviously that should be addressed immediately. That would include, in a feed yard situation, things like bloat, water belly. If we're talking about in a cow herd, talking about dystocias and uterine prolapses, which is an example of what I have in the picture right there. Urgent cases, I define those as things that should ideally be seen the same day or within a 12 to 24-hour period. So these would maybe include like a rectal or vaginal prolapse, maybe a sudden onset of lameness, especially if it's a bull who's going to be turned out soon. We want to see that pretty quickly to make sure that he's time to go on the pasture. Routine cases, those are things that can be scheduled at a convenient time during the normal business day. So sometimes maybe like some eye lesions, pink eye lesions might be an issue there, a little bit of snotty nose. But again, we don't want to wait terribly long on these things. We don't want to let them get out of control. So a good relationship with your vet, that can help you determine what are the things that you can handle on your own, but what are also the things that you should never try to handle by yourself. So I have some blank template sheets here that I've used in the past to develop treatment protocols with some clients. On the left, you'll see some of the conditions we might see, and then as a veterinarian, I can fill in a recommended treatment, whether it's an antibiotic, an anti-inflammatory. I put in the dosage on a weight basis, the route of administration, withdrawal period for both meat and milk, and then maybe some comments on, when to use this, when not to use this. Are there certain circumstances where this would be an inappropriate use of an antibiotic or other medication? And then I would fill in, different things where maybe addressing a foot rot issue, how to assess a foot, a lameness issue to check for, a nail in the toe versus foot rot, things like that. And I've got this broken down by body system here. So over here, we've got it under digestive system, skeletal system, urogenital. So a lot of the breathing things will be on a sheet like this. But this is something that very easily you can put together with your veterinarian. And then I've listed here kind of a general vaccination protocol for calves arriving at backgrounding. And again, this is very this is going to be very general. Your situation is going to vary. I kind of put this together on the assumption that these are calves not from your situation. They're arriving commingled. Maybe they haven't been preconditioned. Maybe they were weaned and put right on the truck, potentially trailered in bad weather. Kind of assuming that we've got some high-stress calves coming in here. So if they're coming in, with a high-stress situation, I like to take it easy on them. I don't like to push them too hard because they've got so much going on in that stress response that if we do too much, it's either going to push them even further and cause more performance issues, or it's going to hinder their ability to respond to these vaccinations. And so on arrival, doing an intranasal vaccine and a pour-on dewormer, pretty low stress. We're not causing a really major immune response there, but we're still getting that mucosal immunity for some upper respiratory pathogens. Whether or not we need to maybe, if these calves are coming in and they're really looking tough, it might be a situation where maybe we need to do some mass treatment, which is called metaphylaxis. Maybe treating everybody with a certain antibiotic as they run through the chutes would be a good idea. In some cases, you might be able to do that metaphylaxis with a VFD, with a feed through, but if these are calves that aren't used to your bunk line, they might not be coming up to eat, could really have some challenges in getting sufficient medication into them. So then after those calves have become adjusted to being in their feed yard, into the new surroundings, 7, 10, 14 days later, that's when I'm going to come back and do kind of the main processing. So getting a 7 or an 8-way Clostridial in there, maybe a tetanus shot if we need to be banding any bull calves, having a 5-way viral pneumonia vaccination, whether it's a modified live or a killed vaccine. And there are some different variations that would have bacterial protection, like for Mannheimia. There are some standalone products out there for Mycoplasma. At this time, if you need to do some implanting, again, castrations, dehorns, any follow-up treatments, that can be something that we take care of after we've gotten through that adjustment stress stage. And then coming back 6 to 8 weeks later again to booster those vaccines so we can get the best antibody response that we can, and then addressing anything else we need to do, a follow-up dewormer, lice control, especially this time of year. We're in the late fall right now, so this is the time when lice are potentially going to become established. So getting something on board to prevent that is just going to help, reduce the amount of rubbing, the amount of stress they're going to be dealing with. And then anytime you're using vaccinations, you want to be observing the label directions. If it's a sub-Q injection, give it sub-Q. If it's an IM injection, give it IM. Give it in the right place. We want to practice changing our needles frequently. We don't want to be giving injections with dirty or dull needles, because that's going to drag in bacteria, drag in filth that could not only cause local infections, but also inhibit our vaccine response. We want to practice good BQA. That's part of it right there. To try to minimize our injection site lesions and giving them in the appropriate locations so that we're not, getting lesions into good saleable product. Again, we want to store and use these vaccines appropriately. If you're mixing up these vaccines, only prepare the amount that you're going to use in 1 to 2 hours. If you're running 500 calves through the chute, you do not want to mix up 10 50-dose bottles all at once, because the quality of the vaccine that calf number 499 is going to get is going to be vastly reduced compared to what calf number 49 received. So we want to do whatever we can to maintain that vaccine's efficacy. You're paying good money for these things. Don't shoot yourself in the foot by doing improper handling and making them less efficacious for you. So in conclusion, when we're thinking about setting up calves for success on feed, we really need to be thinking about this much earlier in their life, and even before that calf is even conceived potentially. Stress on stress on stress is going to stack up over time, and we're going to see those compounding effects as we get further on in that calf's lifespan. Stress is for the most part bad. A little bit of stress is good and necessary for appropriate immune response, but we don't want to have so much that it actually reduces the effectiveness of those immunizations. Even the best prevention or treatment will fail in the face of insurmountable challenge or insufficient resources. This means that if you have cattle that are too stressed out or don't get enough support, are not physically going to be able to mount an effective response. Always going to recommend utilizing your veterinarians to develop treatment and preventative health plans, but also use your nutritionists as well to formulate rations that are going to be appropriate, because these calves are not going to be able to do anything without the building blocks necessary. With calf prices the way they are right now, we're in November of 2025. Calf prices are looking pretty good. Now is a great time to consider updating or improving our cattle handling facilities. This can help us reduce the amount of stress on the calves as well as on humans and make life better for all parties. So those are just my final thoughts. I'd like to thank you all for your attention on this. And if you ever have any issues or questions, don't hesitate to contact me, Dr. Galbreath, NDSU Extension Veterinarian. Thank you.